Medical billing is more than submitting claims. Now, you probably wonder, what does that mean as a small medical billing business owner? Submitting claims, of course, is one of the job duties that we have, but there can be many more. Depending on the services you offer as a small medical billing business, then you can have a plethora of duties that you'll have to do. I'll be breaking some of those duties down in this video, so let's jump into it. My name is Tamika. I'm a certified professional biller and a certified professional practice manager. Now, we all know that providers are different. So they may require different services from us in our medical billing business. When I do my remote one-on-ones with other medical billing business owners or medical billers who want to start their medical billing business, some tend to ask me, what services should I offer? Or maybe they might say, I want to do AR only, and I'm not sure, can I do that? Now, first to start off, this is your billing business. So you can provide any services that you want to provide. Now, of course, I would say, my opinion, that you provide services, number one, that you know how to do, and number two, that relates to medical billing if this is supposed to be a medical billing business. Now, of course, submitting claims is probably one of the services that you'll offer. If you don't submit claims, or if someone's not submitting claims, then the rest of the process is not going to be able to be fulfilled. You also can offer payment posting. Payment posting hopefully is something that you will do, because after you have submitted your claims to the insurance company or the third-party payer, then you want to get paid for that. So if you are posting payments from the insurance company or from the patient, that can also be a part of your duty. There also will be claim follow-up. So sometimes you submit a claim and it's rejected or it's denied, and you need to figure out why, or it's paid incorrectly. You need to figure out why you're not being paid correctly. So that's part of the duties that you might also have. Then, of course, you might need to send out patient statements, talk to patients on the phone, get payments from the patient, because after you have submitted a claim, sent it to their insurance company, then there still may be a portion or a co-share, a responsibility that the patient has. So those four duties, in a nutshell, they're broad. There are many things under those, but those are the duties that most or some of the medical billing businesses offer. You don't have to offer all of these. You can offer some and not the other. And depending on the provider, they may agree or not agree to that. Because if it is a small provider, and let's say they don't know anything about billing, they don't have much staff, they may want you to do everything from claim submission to patient statements. And if you say, well, I only do accounts receivable and I don't do claim submissions or patient statements, they might not want to go with your medical billing business. But that does not mean that you have to then offer that. Now, there are some other services that I put in a category like, it may be nice to have, or some medical billing businesses do this if they maybe have more staff or if they're not having a lot of providers. But as for myself, some I offer, some I don't, but it's not something that you're required to do, and I don't necessarily think you have to do them. So one of those is prior authorizations. Prior authorizations is something that a medical biller would have to deal with pretty often, especially if it's in a specific specialty that requires prior authorizations often. Maybe ambulatory care centers, or, physical therapy or chiropractic, like probably some of those, you may need to get prior authorizations often. And that can be one of the services that you provide for your provider. You don't, again, have to provide that, because I don't provide prior authorizations for my providers. Providers that I have, they also have a staff. So when I say I don't do prior authorizations, they're okay with that, because their front desk staff tends to deal with that. Along with eligibility and verification of benefits, I don't do that either. My providers, their staff does that as well. Now, don't get me wrong. If there is an issue, if the front desk has a question, if, maybe eligibility is not even verified and I have to do it myself maybe once or twice, I do that because, of course, I know how to do that and I should know how to do that as a biller. But it's not something that I do regularly, especially because I also have a full-time job. So doing eligibility and verifications and doing prior authorizations, I can't do that. It would require too much time that I don't have to give. So that is a service that you may want to offer, or you don't have to offer it. Then we have contracting and credentialing. And those two duties, which are separate, they are not the same. They tend to get mixed up as well. But they are duties that most of the times medical billers do, but it's not technically it's not a medical biller's job. But I guess because it's so closely related, the same way eligibility and prior authorizations are related to medical billing, because if we don't have a prior authorization, then we can't get paid, and it affects our job. A lot of times providers think that these jobs, we're supposed to do them, or that is the duty of a medical biller. But technically it is not, at least in my opinion. So contracting and credentialing is one of those other duties that, is so closely related to billing that sometimes billing business owners tend to do them. Now, I don't do contracting, but I do credentialing. And I like to do credentialing. I do credentialing for my local providers here on the island. It's not included in the basic billing package, but it is a side service that I provide. And if the providers want it, they can pay for that. If they don't, then they don't have to. Coding is another service that you may decide to offer in your medical billing business. Now, for a long time, before I decided to, really branch out on my own, I was concerned about doing coding, and I wanted to know, is this something that I have to do? Is this something that I need to know? Because if you have been on this channel anytime, you know that I do not like coding. Now, I don't like coding, but I do know how to code because, again, it is so closely related to billing that I thought it would be important for me to make sure that I do know how to code. However, you don't have to know how to code. If you are not offering coding in your medical billing business, then the provider needs to know that. You need to put that in the contract. It needs to be clear. Again, sometimes the providers read that, sign the contract, and somehow still believe that you're going to code because they don't know the difference between coders and billers, and they tend to get it mixed up pretty often. But you as the biller, you as the owner need to be clear to let them know and understand that coding is not something that I do. And just in case you're not clear on what medical coding is, it is actually the process of reading through the records, reading through the notes, and choosing the correct procedure codes and diagnosis codes. So not just randomly choosing a code, Googling a code, that is not coding. If you are offering the services of coding, then you should actually be able to read the records. You're not just going to take what the provider gives you on the super bill or the encounter form. You're going to actually go through and look through the documentation and then choose your codes from there. So if you're not offering that service, the doctor needs to know that upfront so that, there wouldn't be any confusion. The next thing is consulting. And I also offer consulting in my medical billing business, and it just depends on what it is. Now, since I'm also a certified practice manager, I do consulting for the front desk, for medical billers, for the provider. Like, I do different types of consulting, and sometimes the providers feel like those are services, or they tend to ask you, are those services that you offer? If you are telling them things that maybe are not going right or look wrong in their practice, then they might say, well, can you train us, or can you consult with us about this specific information or whatever it is. And if that is a service that you offer, then you can do it. But that is something that a lot of medical billers do, because we have noticed that in doing the billing for certain providers, they need certain areas to be addressed or to be fixed in order for us to be able to do our billing correctly. So I know that's why I have offered consulting in my medical billing business, and other billing business owners I know do the same. Now, I also threw in another duty that may be one of a medical biller in their own medical billing business, and that is bookkeeping. I have heard recently a lot about medical billers or medical billing business owners who actually do bookkeeping as well. Bookkeeping and medical billing are two different jobs, but again, depending on the provider, they may want you to do their bookkeeping for them as well, especially if you are familiar with what to do, deposits and QuickBooks or whatever accounting software you may use. They may want you to also do that as well. It's not a service that is normally, I would think, linked into a medical billing business, but it's one that I have noticed that has become more frequent when it comes to medical billing businesses. So that can be something that you keep in mind if you are a bookkeeper or if you know about bookkeeping and you want to help your provider in that way. Now, training is something that you may offer as an included service in your medical billing business services, or it may be something that you decide to separate and, have an additional fee attached to. Because in my experience, I have always had to train someone when it came to how to do things in the practice. Again, whether that is the front desk, whether that is the provider, I have always had to train someone to do something that would then help me when it comes to my billing not being incorrect, not being wrong, not being, not taking me so long to have to do because other people are messing up or doing things that are affecting my work. So I have trained individuals, or I have started to tell them different things, show them stuff, give them a little education, whether they are paying for it or whether it's just me telling them so that it would then help me in my billing. Now, if you're ready to open your medical billing business, be sure to download my free checklist. And you can go through the checklist, check off all the things that you need to do so that you can get this business started. And if you have specific questions about starting your medical billing business and you want to talk to me, be sure to schedule your remote one-on-one. I have limited spots. It's only me. And if you're trying to get in, make sure you get in and schedule your remote one-on-one today. And I'll see you in my next video.